I rate the chance of a nuclear war in my lifetime as being fairly low. I rate the chance of a widespread epidemic far worse than Ebola in my lifetime is well over 50%.
Prime footing in an effort to try and stop the spread of the deadly coronavirus.
Self-isolating at home after she tested positive for COVID-19.
It was New Year's Eve 2019 when health officials in China admitted they had a problem.
Health authorities have activated their most serious response level
after an outbreak of a new type of viral pneumonia
in central China.
A rapidly growing number of people were developing a dry cough and fever before getting pneumonia. And for some, it turned fatal.
Assalamu alaikum jami'an wa rahmatullahi wa barakatuh. The purpose of this communication is to continue building awareness around the current COVID-19 pandemic. Definitely it is not meant to be authoritarian. It's a matter of answering some of the concerns that we've been receiving from our community members. I think we need to familiarize ourselves what the COVID-19 means. COVID-19 stands for coronavirus disease, and 19 it's because diagnosed basically on December last year. Now, COVID-19 is a virus that belongs to the family of the coronaviruses, and corona means a crown, and that's why it's been initially referred to as a coronavirus. There are many other viruses on the same family that they also can cause respiratory symptoms like the cold or the common cold or the flu. The most familiar, I would say, members of the coronaviruses is the virus that is causing the SARS outbreak and also the MERS. Now, COVID-19 is a new virus in the sense that we did not have it discovered or described before this outbreak. It behaves a bit uniquely in the sense it does produce the respiratory symptoms that we are all familiar with certain variation. For instance, it would make you have the fever, which happens in 98% of the patient. It gives you cough, however, the cough is usually dry. It gives you headache, but not as common. It gives you sore throat, again, is not as common as you would have with the flu. It makes you a bit fatigued, and it basically acts like the common respiratory symptoms. Now, what's confusing, of course, about this is that these symptoms are also produced with other viruses. Hence, it's difficult to differentiate between the symptoms related to this new virus and to the other viruses. Now, why this is important? It is important because this virus behaves a little bit differently than the other viruses. It is almost acts as an elusive virus in the sense people who are infected with the virus may harbor the virus within their systems up to 2 days or so without producing symptoms. And when they do produce symptoms, many of the people who would have the virus would have very mild symptoms. This gives time for the virus to spread undetected. And by the time people come up with symptoms, they've already maybe infected others who are not aware of it. This increases the impact of the spread, gives more time for the virus to spread undetected, and of course it would down the road cause more impact on depleting our resources. Well, like most of the communicable diseases, you need basically to stay away from the source of the infection. And if you have the infection, of course, you need to prevent it from spreading to others. So, in brief, act as if you are having it and others also having it. And I think this is the advice from the Minister of Health of China, which is very intelligent. At this stage, what we are worried about, that we already passed, I guess, the stage of containment. We are in a stage of mitigation. So our purpose is to practice what we call social distancing as much as we can. Of course, that just minimizes the risk of the spread. The golden rule is to frequently wash your hands the proper way. Usually we say 15 to 20 seconds. Also, people usually pick up the virus with their contaminated hands after touching a contaminated surface or having the virus on them after they sneeze or cough, and then they take the virus and inoculate themselves with it or inoculate others with it. So if it happened that your hand is dirty with the virus, is contaminated with the virus, and unconsciously you go and touch your face, your eyes, because we rub our eyes, or your nose or your mouth, you now have basically delivered the virus inside of your body. We would assume that you have a high load of viruses in your hand. Now it is already into your mouth. You inhale it, you swallow it, it basically contaminates or basically spreads down to the inside of your mouth and your throat, and then basically it starts to get into your respiratory system. So washing your hand is really very, very important. The second thing is you stay away from people. Of course, we mentioned that initially, those who are having the symptoms. If people cough or sneeze, usually within 1.5 meters to 2 meters, these droplets can travel to. So ideally, that's sometimes difficult to enforce. Ideally, you'd like to be at least 1 meter to 1.5 meters from people who do have the symptoms. Now, since we don't know who has it and who does not, because as I said, symptoms could be very mild, it's advised to stay away from people within that distance. Now, don't go to the emergency room. Don't basically overload the emergency departments. There are centers that are open now in different cities that you can either physically go to when you meet the criteria to go to, or basically the best way to do is now to call what you call Telehealth Ontario and basically check with them for further instruction. The number is on the website. We already have sent this number to our community members, but the number is 1-866-979-0000, and or you can go and check your local public health unit, which also we have the link for it on our website. So basically call this number, tell them about these symptoms that you're having, and follow the instruction. It's like any cold that you will take the usual precautions. You will stay at home. This is the current recommendation. Self-isolate, stay at home at least for 2 weeks. Keep yourself well hydrated. Take the usual medication that you would take for cold. If you have a headache, you can take some acetaminophen if there are no contraindications. You drink lots of water, you eat healthy, rest well, sleep well, and don't go to the hospital unless you need to. Now, when you go to the hospital, per the advice of your local public unit or the advice of a physician, make sure you don't go with a big company. You may need only one companion to come with you, the one who's the most relevant to you in case more information are needed, because that person now, since he's exposed to you, will need to practice self-isolation, and if he needs to stay in the hospital, he will be the only one who will stay with you in the hospital, and he also will need to practice self-isolation. Once in the hospital, you have to follow the visitors, of course, rules, and it would have an impact on, of course, on those who would be allowed to visit you.